Welcome back. With more than 30% of cancer patients being diagnosed with depression in South Africa annually, the South African Society of Psychiatrists has called for greater awareness of patients suffering from mental health disorders. This as the country today marks the National Cancer Survivors Day. Cancer is the second leading cause of death globally, with an estimated 1 in 6 deaths, or 9.6 million fatalities. The most recent statistics available indicate that in South Africa, 108,168 men and women were diagnosed in 2020 with cancer. Experts say being diagnosed with cancer and being a survivor is a scary and emotional experience. They further say that some people may go through a period of grief before being able to accept their diagnosis, while others become depressed and anxious. Let's speak now with Dr. Michelle King. A very good evening to you. King is a member of the South African Society of Psychiatrists. A very good evening to you, Dr. King. Thank you so much for speaking to us. So, as I mentioned, with that figure, more than 30% of cancer patients being diagnosed with depression, what is the cause? What is behind this?
Well, I think that it's the cancer itself. I think can be more scary than hearing that you have this illness that's going to lead to your death. And for most people, that they're going to, like you said, they're going to go through that period of grief where you feel sad and angry and going through times when you're just in denial and finally reaching acceptance. But when you're depressed, it's not a normal emotion, you know. Being depressed takes away your ability to be present and in the moment with your family and with your friends. And not just that, it actually impacts the physical illness as well. You know, we see patients who are suffering from depression having much greater rates of mortality and morbidity. So bringing awareness about depression in cancer is so important, because it's not normal. You know, there's this false belief out there like, oh, well, you're facing your death, you should be depressed. And that's not the case. So I'm really glad we're having this opportunity to have this discussion today.
And we'll talk about the symptoms and how they present in just a moment. But I want to go back to that figure that we mentioned earlier on, that cancer is the second leading cause of death globally, with an estimated 1 in 6 deaths. But who is most vulnerable?
Who's most vulnerable to getting cancer? I think that's the thing. I mean, there's no one person who is vulnerable to getting cancer. We're all vulnerable. And it becomes so important that we take charge of our health. You know, whether it's making sure that we're living healthy lives, we're not smoking, we're not consuming too much alcohol, and, you know, going for regular checkups when we need to, whether you're a male or a man or a woman. We need to be screening ourselves for cancer so it can be picked up early and not left until, you know, it's too late to do anything about it.
And it's not hereditary in any way?
Certain types of cancer are hereditary, especially certain types of breast cancer. If you have the BRCA gene, that can be a hereditary type of cancer. But yeah, not all types of cancers are hereditary.
So, as we mentioned earlier on, that being diagnosed with cancer can be a very difficult thing. Being a survivor is scary. It's an emotional experience. I was wondering, is there pre and post counseling when you are confronted with such news?
Yeah, definitely. And I think for so many people, we have this idea that palliative care is only for people with cancer or people with a life-limiting illness when they've just got a few days or a few weeks left. But when in fact, at the time that you're being diagnosed with cancer or with a life-limiting illness, that's when you actually need to start engaging with the palliative care team or with the palliative care provider, because those are the professionals that are going to be able to give you the proper support and the proper advice. You know, it's a journey that they're going to go along with you. And yeah, so it's at time of diagnosis when you need to put that extra support in place, not at the end of the journey.
And healthcare professionals, are they always able to accurately diagnose the depression and anxiety, or diagnose it in time?
So I think it's a tricky thing, because we do know, if we look at the research, that it frequently does go undiagnosed and untreated. And like I mentioned before, the one is this false belief that it's normal to be depressed when it's not. The other thing that we see is some healthcare professionals just don't feel comfortable talking about emotions, so they don't ask. The other thing is, it's a complex diagnosis to make, right? Because you have this interplay between the physical symptoms that the illness or the treatment of the illness is causing that look very much like the physical symptoms that we get when we're depressed. And then the other thing is patients' expectations. You know, you might be going to your doctor or your oncologist to follow up your blood results or to talk about your CT scan results, and you're not going there with that expectation to be talking about your emotions or the fact that you're depressed or that you're not coping. So you end up keeping quiet about it.
So, Dr. King, I realize that we may be experiencing some problems with bandwidth, but we'll continue. Hopefully you can hear me. What happens if it's left untreated or undiagnosed? Because it's very interesting to hear you say how the symptoms of cancer can often mirror or be the same as somebody who is undergoing mental illness.
So, I mean, if we're not treating depression in a person who's got cancer, we're seeing, like I said, greater rates of mortality and morbidity. So depression in itself as a disorder can actually worsen the cancer through quite a complex immune reaction that's going on. But we do see that interplay happening. So when you're getting depressed, it's actually can affect the progression of the cancer. So we really need to treat it. And like I said before, not treating your depression and anxiety can lead to a worsening of physical symptoms as well. And one of the biggest challenges, or for me, it's if you're not treating your depression, it can drive your pain levels up, right? And that in its own becomes an independent risk factor for suicide. And like you're saying, what happens if we don't treat it? Well, if we left untreated, you can actually get to that point where you're so depressed that suicide becomes an option, or it starts to become like a possible option. And for other people, they may even start looking for ways of going overseas for euthanasia. You know, they just can't bear living anymore, but they want this, death to come quickly. At its worst, like I said, suicide. And we do see that where patients are just so depressed and unable to reach out, that they reach that point where it is unfortunately an option.
And where should people go to seek help? And I'm not just talking about the person who is suffering, but loved ones of the one who are also equally affected by this.
So I think it depends on what kind of help you're looking for. If you are suicidal, there's definitely crisis hotlines out there. South African Depression and Anxiety Support Group has got a crisis line. If you're looking for palliative care, PALPRAC's website has got a great list of providers that you can find in your area. They're definitely the ones who be able to help you, get the resources that you need in order to get the care that you need. And it's also about speaking to your doctor. I mean, your GP, even if they're not comfortable prescribing medication, they can refer you to a psychologist or a social worker and even a psychiatrist if it's necessary, that you can get your depression treated.
Thank you so much for your time. Dr. Michelle King is a member of the South African Society of Psychiatrists, just talking about the link between cancer and depression.